So in pregnancy and birth, what does informed consent look like? I talk about informed consent a lot, but I realize that not everybody knows what that means. This means that your provider has gone over the risks, the benefits, and the alternatives to any procedure. And let me be clear that this includes being given all of the information. Because unfortunately, the problem with informed consent is that a provider can offer you just their perspective according to what they think you should be doing. And this is why it's really important for you to then go research all the things. But I can tell you what informed consent does not look like. We're just gonna check your cervix real quick. I'm gonna go ahead and just break your bag of water. I'm just gonna do what we call membrane sweep. I mean, the list goes on and on, you get the point. Because they're doing these things or making statements instead of, first of all, getting your permission and discussing the risks and benefits to what they're about to do. Oh, by the way, I have one of those heatless hair curlers. If you haven't tried it, dude, pretty sure I will never use a curling iron ever again. Okay, but I digress. And what always legally goes along with informed consent is the right of refusal. That means your provider can give you the benefits, the alternatives, the risks, and you are the one who gets to make the decision on whether or not you want to go forward with whatever it is that they're suggesting. Rarely is anything emergent, and it's perfectly okay to ask for time to look stuff up if it's something you have to make a decision on immediately. In my next video, I'm going to talk about questions that you can ask your provider so that it's a good dialogue going back and forth. And informed consent never looks like coercion, criticism about your questions, or sarcasm about your questions. It never looks like manipulation or over-exaggeration of the risks. These, unfortunately, are extremely common. Second-time families are the ones most commonly hiring a doula. And almost always the thing that I heard most often was they were so dissatisfied for how their birth went and how little they knew going in, that a lot of times if they said, if I wish I'd known this, I wouldn't have done that. And I personally think that's not okay. You shouldn't have to hire a doula to do all these, to figure all this stuff out. But how much education can a provider give you in their 6 to 12 minutes of a visit? You, and only you, should be taking ownership of your care. Help me get this out to more people, because that apparently, I've learned that that little like button right there, that little heart, the more you click that, the more people see this. Let's help all pregnant folks have the best opportunity for a great birth. Well, and postpartum, because I talk about postpartum too. You're the best. Thanks.